When it comes to helping people with more involved conditions such as Parkinson's, epilepsy, Down syndrome, multiple sclerosis, chronic fatigue syndrome, fibromyalgia, people, if I say I can help them, they go, oh, you're going to cure my MS? You're going to cure my child of Down syndrome? No, that's not what we're saying. And if you go back and read my book, Let It Flow, I clearly state our job is not to cure the body. The cure is running through all of us. What our job is to do is to unblock the blockages. What causes that neural disorganization could come from a fall, a trauma, a birth trauma. And in the case of things like Down syndrome, there is a genetic deficit. But all of these still produce disorganization of some of the circuitry. For example, common to Down syndrome might be that they drool. They don't have the suckling reflex. It could be tied in with the genetics, but we still have a correction that can check if that neurology is off, do the correction, and turn it back on. I remember in my early years working on a Downs baby, and the parents were ecstatic. They were very clear. I was very clear with what I could do for them. I did the corrections. The next day they said he stopped drooling. And they were ecstatic. I mean, that alone was something. It's not like he didn't have Down syndrome anymore, but you never know what's possible until you bring them in. So now the same thing with things like multiple sclerosis, which is a multiple hardening or myelination of the nervous system. We have certain theories on this that possibly what's happening is there's rotation in the spinal cord, and so the cerebral spinal fluid is not going and completely nourishing and having access to all the crevices and areas of the brain and spinal cord. And if the trauma happened, for example, like a car trauma or a heavy rotational neck trauma, and the nervous system is frozen in disorganization, but in relation to the neck torsion being here, that person down the road might not have those fluids going properly or easily through the cervical spine, but properly through the lumbar spine and the thoracic spine. And these nerves in this particular area might not be getting nourished. And so as time goes on, now they're finding that those nerves are not myelinating properly. So the person's been having symptoms relating to what's controlled by this area of the cervical spine, which possibly could be the thyroid, the nerves going up to feed their tear ducts, or their head, or their blood vessels. So they might say, oh, I get vision disturbances, ear disturbances, thyroid, my throat's always scratchy, but they're fine with the lumbar spine. However, if a person had a trauma and they had the seatbelt on, for example, and wham! And now the torsion was more in the thoracic spine, so the apex of the rotation is around this area. Now it's the thoracic nerves and part of the spinal cord that might have issues. And so these people might start having breathing issues or problems with some of their visceral organs like the pancreas or the liver or the stomach, which are neurologically fed from this area of the spine. So they might end up having that, which is why in multiple sclerosis they cannot pinpoint why it's happening in other regions for different cases. What we can do is correct the cranium and the jaw and the tailbone and the rotation. And you can see the video I've created also on scoliosis. That always involves some form of rotation because the nervous system is stuck in one of these positions out of true zero, anatomical zero. And then the nourishment or the cerebral spinal fluid can start flowing properly. Obviously, the earlier the better. This is a preventative type of treatment. So we can find these things in their early stages, okay, before people get this diagnosis that, yes, you have MS. In the beginning, some people might just have tingling feelings, which they just say, oh, it's nothing. Or they'll go to chiropractors, which is good, and get adjustments, but the tingling is still there. Then they'll eliminate things like diet drinks, which have aspartame and NutraSweet, which are deadly on the nervous system. They should not be used by humans or anybody. But, okay, they eliminate those things. Still, they have the tingling. This is where they should be looking into, this could be, I've done a process of elimination, but maybe I need to look into getting detorqued neurologically, get reset. So you can see the same thing applies for epilepsy. Epilepsy has to do with a certain area of the brain being under tension. And so when the stimulus gets to be too much, they hyperfire. I've worked on lots of epilepsy cases, some very successfully. 1, 2 treatments, boom, seizure stopped. Couldn't believe it. And some, they persisted. Now in some of those cases, those patients did not change their diet, or they continue to smoke marijuana or do certain things that were not beneficial. And some might not be coming just from neural disorganization. And also, some of them might have permanent bruising of the brain. It will still reset the circuitry and get the pump going, but like a bruised pear, you cannot change the bruising. You can take the pressure off the pear, but the bruising and the damages happen. But once again, you don't know unless you try this out. What have you got to lose? It's just 1 session, 2 sessions first to see if there's changes. Then you can proceed with other therapies or go deeper. And the same thing now that's being called PTSD. This is the jungle. I mean, yes, we have our traumas, and I feel for those, and I have compassion for some of the things people go through in their emotional lives and what we do while we're here on Earth. But if you are in physical tension, if you are in disorganization from when I fell off the change table or when I got hit in the head by my brother with a golf ball by accident, or whatever your story is, you don't realize you're in neural disorganization. Now it's 10, 15 years later, your nervous system is already on hyperdrive, and now the external world pulses you with something, and then we collapse. Oh, the job was too much. The divorce was too much. I went into the army, and that was pretty traumatic. Well, these are things that they're labeling as PTSD and then giving medication. And I've worked on lots of PTSD cases, and they find it's much easier to now move along to talk therapies and start healing properly. But if the body's stuck in physical defense, good luck. So this is how we can help any of these conditions. And for example, Parkinson's, well, this is a certain area of the brain that produces dopamine. That's in the central part of the brain called the substantia nigra. Again, looking at the big picture rather than going right to the substantia nigra, what if the cerebrospinal fluid is not able to get in and nourish those deep areas of the brain, and because the body has been in tension from an old trauma and the cranium has been locked since the football game when they were 18 when they got hit. And it's 20 years later, and now they're showing in professional sports that some of these boxing, football, a lot of these players, ex-players, and even now the younger ones, are starting to show cognitive dysfunction and get early diagnosis of Parkinson's, Alzheimer's, and brain dysfunction. Imagine if we could work on them after the game or once a week when they're doing their training and they're getting their hits. Just do a checkup on all of them, reboot their hard drives if it's disorganized. And if we check it and it's not disorganized, we leave it alone. This is the beauty of N.O.T. and how we have complete control over checking, correcting, and verifying what's needed and what's not.